There's another cost factor which I haven't seen really rolled into this, but is important, which is non-adherence, which is you send somebody out early and you say, please take your drugs, and then they don't. Now all heck can break loose, huh?
Yeah, well, compliance is a major issue. That's for sure. You know, people sometimes don't take their medications because they can't afford them. Sometimes they don't take them because they think they're already fine. Sometimes they don't take them because they have some side effect, or they have to take them 3 times a day, but maybe 2 times a day is just fine. And so compliance could be an issue for sure, and that's an issue that's typical to oral antibiotics, because usually we control the administration of intravenous antibiotics. On the other hand, I should say that we have a more modern definition of compliance as compared to the past, when you got the course of antibiotics and you always had to follow the course of antibiotics. And talking about skin infections, if you have a cellulitis and you got 10 days or 2 weeks of antibiotics, and after 6 days your cellulitis is gone, there's really no data that you have to continue the antibiotics. So while you need them, you have to take them as prescribed. That also means that if you have to take them on an empty stomach, as would be the case with dicloxacillin, for example, which is very important for skin infections, then you have to do it, because otherwise you are under-treated. And you have to take it the number of times a day, and you have to take it until your symptoms are gone. But if your symptoms are gone, I suggest you call your doctor and say, you gave me 10 days, my symptoms are gone after 5 days, should I continue the course? And very often the answer is going to be no.
And I think this extends to even beyond antibiotics. You know, we've moved to really within our meds to beds program, just trying to make sure these patients fill their prescriptions even before they leave the hospital. They deliver them to their room before they walk out the door. So, but with antibiotics, and I think what ends up happening is, we discussed earlier with these patients who have failed, but a lot of times, if you really speak to them, they never even filled the antibiotic, but they get lumped into a group of failures.
Well, I don't want to blame patients here, okay? To some degree, you're laughing, but I think it's true.
Yeah, I agree.
My view, for what it's worth, is a patient who's non-compliant, we didn't educate right. We didn't somehow get that patient with the program. And by the way, I didn't miss the heretic alert here, which is, no, maybe we don't need 10 days, maybe 7 days is okay. But the problem is they're not even taking them for 7 days. How do we do that?
I agree with you. I think, again, the most important thing is, explaining things to your patient. And I think that patients who are prescribed antibiotics, unlike many other, when you get the blood pressure pill, you don't really have a very clear endpoint unless you measure your own blood pressure. Or with diabetes, for example, you measure your glucose. Patients who are getting antibiotics should be educated as to what should they expect. Why do I get this antibiotic, doctor? What do you expect this to do? And if you tell the patient, listen, you're getting the antibiotic because you have an infection of your skin that presents itself as redness and painful and maybe some fever. When your fever is gone and the redness is gone, then you don't need the antibiotic anymore. I think that patients understand that, but you also explain to them that if they don't take the antibiotic as prescribed, the likelihood of that happening or happening fast is decreasing. And I think it's important for patients to understand that as well.
And I laugh because sometimes, you can make the right diagnosis, you can choose the right antibiotic, but sometimes it's that 5 minutes spent with the patient explaining to them at the end that is the most important.
But you hear, I've only got 7 minutes.
Right.
That's all they're paying me for. Well, it's tricky. And out there in society, if people are partially treating infections, whether it's pneumonitis, whether it's cellulitis, aren't we risking the spread of multiply resistant organisms?
Well, yeah, for some types of infections, particularly infections caused by gram-negative bacteria that have the ability to become resistant very quickly, absolutely. You don't take the antibiotic in the right way, you increase the likelihood of resistance. Your own infection may actually become resistant as you get the antibiotic, and your next infection will for sure be more resistant. And so, yeah, absolutely.